we are 98.4 FM. If you're in Alua, we are 95.5 FM. We're also live and clear on another radio station, UBC West Nile, on 98 FM, covering actually sub-region, Lango sub-region, Teso, and Karamoja sub-regions. We're also live and clear on another radio station, UBC Magic 100 FM, covering central parts of this country. Ambair Aman Utega is my name, and we're also streaming live on YouTube. You just enter UBC Ground Zero and you'll be able to watch us live. It is a very interesting day, 2nd December 2023. I welcome you, our dear listener, from the other side of radio, and I want to thank you for using UBC as your favorite radio station, Magic 100 FM, UBC Butebo, and West Nile, but also using UBC Ground Zero as your favorite radio program. I have a very special team of guests in the studios of UBC who are going to be inspiring us with educative and informative in this program or content. And we're going to be talking about HIV/AIDS. As we all remember that yesterday, Uganda joined the rest of the world to celebrate, not to celebrate, we don't celebrate AIDS Day. Maybe we celebrate the achievements that we have realized as a country, as individuals, as the continent of Africa, but also as the world. But we commemorate this day, and in Uganda it was in Lakai. I have people in the studios who are part of this very big event in Lakai, Valley Playground, and the theme that we're still commemorating is ending AIDS by 2030, keeping communities at the center, or letting the communities lead. We're going to have a very interesting conversation on HIV and AIDS. We still continue with the discussions from the yesterday's event where we commemorated AIDS Day. We still prevent. We are still taking medicines. We are still creating awareness about this very fight. And we believe that the more we talk about it is the more that the people of Uganda and Africans will prevent themselves and be aware of how dangerous this is. I have a very big privilege and honor to have Dr. Arthur Himsubwe, is the National Tail for Adults HIV Care and Treatment, coming from the Ministry of Health. Welcome on the show, Arthur.
Thank you so much, moderator.
We also have a privilege and honor to have Lilian Kihumuro, is the Advocacy and Communications Officer coming from Uganda Young Positives. Welcome on the show.
Thank you very much. It's a pleasure to be here.
You've heard from my guests in the studios, and those who are part of us from YouTube, you have seen my guests in the studios. A very interesting team that I believe we are going to learn a lot from them. They have been in this fight. They have been leading their leaders. They are transformers, but they are also health workers. We are going to learn a lot from them, especially for you who would have to know more about HIV, and for those who have had it for the first time, or for those who know but they don't know it in details. We're going to talk about from the time of prevention, the time you have the virus, up to the time that you get cured, if there is that a chance. Let me start with you, Dr. Arthur. You tell us what you do, especially in that Department of National Tail for Adults under the ministry. Welcome again.
Once again, thank you so much, moderators. Good morning, listeners, from wherever you're listening from. I was meant to understand that we are basically covering nearly the whole country. So it would be of importance for me to say that oliotie in that language, oba mukuba mutya wano ewaffe kumpi ejinja, oba muli mutya abatuuliriza wano ate e Buganda, oba ejoka abali eyo Karamoja, or icho nini, one word luo. So that's that. Otherwise, I'm Dr. Arthur Himsibwe, and thanks so much, moderator, for inviting us. I work at the Ministry of Health under the AIDS control program, and like you clearly said, I'm the national team lead for the adult HIV care and treatment unit, specifically at the AIDS control program. And I think as I end greeting people, I can't end without saying that greetings from the AIDS control program family at the Ministry of Health. Thank you.
I would love to learn from you or get it from you what you do in that very department and what is keeping you busy these days as the ministry.
Yeah, thank you so much. Like you very well know, we are looking at the World AIDS Day. And at the Ministry of Health, specifically AIDS control program, we are meant to implement, but also look at the policy guidelines in reference to HIV and AIDS care throughout the country. So basically, like you asked, what we majorly do is to oversee the policy implementation of the guidelines in relation to HIV care and treatment throughout the whole country. And still, like you clearly said, what is basically keeping us busy this time around, everybody is talking about World AIDS Day commemoration, and this is aimed at, like the word goes, commemoration. We are looking at, trying to remember the journey that we have had since 1980s to date, and also trying to remember our loved ones that we lost along the journey, but also trying to celebrate the gains that we have had since we started fighting the epidemic. Currently we are looking at, ending the epidemic by 2030, but also looking at the theme that reconciles very well with the community, and this is the theme that we talked about at the World AIDS Day, which is let the communities take leadership, or let the communities lead. Thank you so much, and over to moderator.
Interesting. Thank you, Arthur, Dr. Arthur. Lillian, I believe that you are also leading in this fight when it comes to HIV AIDS. You've been part of it from the time I have known you. I would love to share your experience, but also what you do as Uganda Young Positives, but also share your experience of yesterday's event, because I am aware that you attended.
Thank you, Amon. Once again, my name is Kumro Lilian Kagava. With the young people, I use Little Pumpkin because it rhymes or goes a lot with them. What do I do at Uganda Young Positives? I'm the Advocacy and Communications Officer. Basically, I make sure information reaches out to the young people, our target population of beneficiaries, with inclusive of every person, but also our organization works in scaling up prevention care and support services for young people living with and those at risk of HIV. Sharing on our experience of yesterday, one, I would say, I think it's the first time I'm seeing very many people from the government attend or be part of the commemoration. Last year we were in Rukunjiri and a few delegates came in, but I'm happy and proud to say that it's heartwarming and enjoying to see that many people are coming up to appreciate these days and celebrate them. My biggest lessons from yesterday, or the biggest experience, was that the president is in the fight with us, and there's one thing that was remarkable that he said. His Excellency said that, would you rather live with HIV, wait to get HIV, or prevent it earlier? In this, he gave an example of, once you're infected with HIV, there is a part of your life, there's a portion that is taken off. However much you're on medication, you're adhering, there's still that opportunity or that portion that is taken off your life. So if you still have a chance to prevent yourself from getting HIV, it's best that you take the opportunity and prevent, because the prevention options are available. So it's best to take use of the opportunities and prevent yourself by all means from getting HIV. Thank you.
Interesting. Let me learn also from you. At least I know what you do, and all of you have updated us on a number of activities and events that you've been engaged in. Give us the statistics or the situation, the HIV/AIDS situation in Uganda, Dr. Arthur. Is it worrying? Are we containing the situation? Do we need more efforts? Because at least we have had a number of efforts that we're going to look into in the course of this discussion. But would love for the listener to know how far we have reached in terms of HIV and AIDS. What is the situation in the country?
Okay, yeah, thank you so much once again, moderator. That is a very, very broad question that you have asked. But to go briefly to it and summarize it, Uganda has made a significant positive strides in the fight against HIV. And this, I can say that by 2021, around 81% of people living with HIV knew their status, which is basically a crucial entry point for accessing care and treatment. But also to mention that around 96% of those who knew their status were on treatment. That is what we call the second 95. So when you look at the conditional cascade, you're looking at around 96% of those adults who are aware of their status. Around 92%. 92% of those ones who are on treatment are actually virally suppressed. So when you look at the conditional cascade, you can comfortably say that we are on track because looking at where we have moved from to where we are, I think saying that we're on track is not being out of context. So in terms of progress, that is where we are. I believe when I talked about 81% of the people knowing their status, it basically means that we have more around 19% or close to 20% of our people in Uganda who do not know their status. The PHIV population, the people living with HIV, the population of people living with HIV who are meant to be knowing their status, but they do not know their status, around 20%. So you can see that we still have a very, very big gap for us to close in terms of ensuring that people get to be diagnosed, but on top of being diagnosed, they are put on treatment that is optimal for them in order to have the virus suppressed.
Interesting. Some good efforts. We're going to look into more of those efforts and details. Lillian, you represent a group of people who are living with the virus. If you don't mind, you can share how the experience is in terms of testing, from the time of testing, and especially what is the situation for those who are living with the virus.
Once again, thank you, Amon, and our listeners for tuning in and listening to us. I would first say, before I go to the whole experience and all that, it's saddening that the community we live in is, should I say, has lost interest in such information or such topics and are reluctant about their lives. That's why we are seeing a huge rise in new infections. But again, coming back to the experience, when I was tested, I didn't know I was tested because I was still a kid and all that. But I would say experience of living with HIV is not easy. That's why, once again, I sent Wekuma Kapila Kambale put the condom on always. It's not safe if it's not on. So the experience is not easy. It's basically hard adhering to medication on a day-to-day. It's hard, especially when it comes to school-going kids, boarding school.
Did you say you were tested when you were a kid?
Yeah, I was
At
tested.
what age?
I really don't know. All I know is I've been on medication all my life. But I can say at a time when I was in P5, I refused to take my medication because I really don't know what was going on. I didn't know what was the problem. They used to tell me you have heart condition. Like parents always cover around and sugarcoat for you to be able to take medication. But I was feeling healthy and okay, so I refused to take my medication. That's when I was given a test when I was at the age of understanding. I remember it was at Kawarola Hospital and I was told my results were positive. Since then, I've been on medication. I would not say the experience has been easy, but if you focus, if you have the right support group, if you have the right people around you, the psychosocial support is right, it reaches a point and you adhere and understand. I would say my adherence was not good right up to my secondary education, but I started adhering and accepting when I was in university. So that's why I'm saying it's not that easy to accept or adhere when growing up, because there are very many challenges, there are very many pulling forces that may fail you to adhere to the medication and accept your status. Still, the issue that is going on today, where we are seeing over 80,000 amongst the 1.38 that on medication, over 80,000 people are not adhering to the medication. It's due to the stigma that we experience that causes adherence to be hard. And basically, I don't think I can blame either the person living with HIV or the person at risk for the stigma, but basically it's the information gap that is causing this stigma to be high. And I would say basically now I've learned to adhere to my medication and I'm supporting other young people to adhere. I'm a mother and I'm proud to say that I gave birth to an HIV negative child. That is why I advocate a lot. I'm an SRHR advocate and HIV prevention advocate. I advocate a lot for HIV prevention options, multiple prevention options, because I know the challenges that come with taking medication. I know the challenges that come with adhering. I know the challenges when you're a teenager and you're starting to want to date or be in a relationship and disclosing is hard. So basically, apart from advocating for prevention options, I also try as much as possible to educate and empower young people to disclose, because there's a lot of power in disclosure of your HIV status. But most of all, it's important for everyone to test. Most of us tukebezama, so like we just look at the person and you see the person is looking good and you believe this person is negative. So unless you've gone for a blood test,
you conclude and have the results.
Basically, that's what
just
we do.
Using eyes.
Yeah, so basically it's important to, before you engage in any sexual intimacy activity, do not test with the eyes. Go for testing. Ministry of Health and Government of Uganda has made it easier for us that you can even test from home if you do not want to go to the hospital. So it's important to test and protect or guide your life, and because you do not have any other chance. And once you're HIV positive, there is no going back. Yes, we have art and all that. You can live positively for a long time, but believe me, there are opportunities that you'll excuse me, there are opportunities that you'll lose out on because of your status. Like, there are people want to go and work abroad, but there are countries where they will not accept you because of your status. People want to go in the army, but just as like our president said yesterday, you cannot work in the army, not because they are stigmatizing you, but because of the vulnerability of your health at any time. Being put under harsh conditions is also a risk. So if you still have a chance to protect yourself and stay negative, I would advise stay that way.
All right. Oh, dear listener, those who are watching us on YouTube, we are live on 4 radio stations and also streaming live. You can watch us live on YouTube. Just you enter live UBC Ground Zero and you'll be part of the conversation. Ambaida Amon Utega is my name, and we have Lilian Kuhumuro and Dr. Arthur Himsue. We're continuing with the program. We're looking at ending AIDS by 2030, keeping communities at the center. Dr. Arthur,
Yes.
Gone are the days when we had reported people test with the eyes these days, but during the time that this virus had been introduced in this country, you could tell that someone is infected and it would probably be right by 80 to 90% because of the symptoms. Someone being slim, loss of hair. Have we had any other new symptoms? Because it is hard to tell that someone is infected like in the past. So how can I or someone know that these symptoms could be probably mean that I have the virus?
That's very, very, very interesting. The first thing that I want to first mention, like I mentioned at the start, we have had significant strides in the fight against HIV, AIDS. So the symptoms and signs that you have mentioned, the aspects to do with the slim of those days, those were the symptoms of what we call AIDS. Now, AIDS, for us to understand it from the basic and first principles, is basically a combination of diseases, a combination of infections that a person gets because the virus, HIV virus, in his or her body is so high, and the CD4 cells, the cells that fight against disease, are very low, in that other infections can easily attack the body and make his or her body very weak to cause what you have called slim. And like we have said, gone are those days when we are, when you could just look at people, start diagnosing them by the eyes and that kind of thing. Just to give you a little bit of statistics, taking you back in 2010, that is just 2010, a decade ago, we are talking about around 100,000 new infections. Currently, we are talking about around 50 to 52,000 new infections. But also to note, in the same year around 2010, we used to have around 50,000 deaths due to HIV, what we call AIDS-related deaths. 50,000. Now, in 2022, we are talking about 17,000 deaths. So you can see that there is a very, very big reduction in the number of deaths due to AIDS, and there is also a very big reduction, to a tune of around 40%, in the number of new infections, just considering 10 years back, that is 2010. Now, if you are to consider the 1980s and the 1990s, definitely the figures would even be drastically dropping to date. Now, what you asked that what can we use, to see a person and then you start labeling them HIV positive, HIV negative, that is what we call stigmatization. You cannot see a person by the look of the eyes and you start labeling them either of any disease, even if it is not HIV, because we are in the world where HIV is no longer supposed to be a laughing matter. We are in the world where HIV is supposed to be a concern and a burden to each and every one of us. And to mention, we are not in the world whereby you are going to see a person, even if you know the status of the person, like my sister here, she's free to speak about it. She has HIV and she has no problem with speaking about it, but does not give anybody the audacity to start labeling her in any way, or by looking at her, maybe look at swearing at his eye, swearing at his body, and then start claiming that the swearing is because of HIV. So the direct answer I wish to give you, moderator, and the listeners, is that that is stigma if you are to look at a person and start labeling them of any disease and it is something that we call discrimination that we wouldn't want to have. In case anybody wants to know of the status either of a partner or himself or herself, it would be prudent for them to go to the hospital, test, and then their status is revealed to them, rather than seeing a person and then you start labeling them this and that.
Interesting. People stop testing with your eyes. It's better you go to the hospital and test yourselves or test your partners. Uganda young positives. When does someone have AIDS?
Thank you so much.
Because I learned that you can have the virus, you can have HIV when you don't have the virus. Is that true?
Thank you for the question. Just like Mr. Ahimbisiwe said, you cannot have HIV when you don't have the virus. HIV is actually the virus, but there's a difference. There's a thin line between HIV and AIDS. They are two different things.
It is possible to have HIV and you don't have AIDS?
Yes, it is very possible to have HIV and you don't have AIDS. Why we are saying this is because we have said HIV. I usually in the community use an example of Uganda just to be a bit more clear. Just like he said, HIV is the virus that attacks the body and fights the immune system or weakens the immune system, what most of us know as CD4 or the white blood cells. So when it weakens that, it starts building up or reproducing and then taking over the whole body. Just as I said, I give an example of our country, Uganda. So we are looking at Uganda as our body and the citizens of Uganda as the CD4. And then I'll use the Lord Resistance Army as the HIV virus. So if the army comes in and finds Ugandans, and then what we call ART, the medication that people living with HIV take, is what I'm going to use as our UPDF army in Uganda. So if Lord Resistance Army comes into Uganda and finds the army or the UPDF is not there, it will obviously come into the body or come into the country and take over and do whatever it wants within the country, Uganda. But if the Lord Resistance Army comes into Uganda and tries to come in but finds UPDF in control, it will be fought against and maybe it will not have the power to come and take over the body as much. But as I said, if they don't find that army there, which we are looking at as ART, then they'll be able to come into the country and take over and do whatever they want. That means if they want to kill people, they'll kill them. If they want to take gold or take the parliament over or the state house and use it, for whatever they want, they will do that. So the same happens with our body, that when HIV comes into the body, it attacks the white blood cells or CD4 and basically kills them, I'll say that. So your body no longer has strength to fight over any disease. That means malaria will take over, cryptococcal meningitis will take over, herpes will take over. Like, you'll have a number of diseases and infections. So once you have all those diseases and infections, like once your body is that vulnerable to many diseases and infections, that's what we call AIDS. Like, you're sickly, you're very weak, you have the weight loss issues, the skin issues, that is AIDS. So basically the symptoms you're talking about,
so when ADF takes over the country is when we have the AIDS in the country.
That is when we have the AIDS in the country or in the body. So once has taken over and is able to do whatever it wants with the body, then you have AIDS. That's when those symptoms you are talking about come in. But when you have HIV and you like adhere to your medication, then you'll have a healthy life. That means the Lord Resistance Army will not be able to do whatever it wants with your body. However, there's a point you were talking and you said in case of cure. So basically we do not have a cure yet, right?
There is no way we can take the ADF when they have taken over.
Well, just as I said, when they do take over, as you've seen, I'm a healthy young girl. I do not have any signs of being sick, right? So with the body, if you're taking your ART medication well, the virus tends to sleep or reduce. So basically that means in the bloodstream they will see very little or none. Like, that's what they call viral suppression. That means in the blood the virus is really not being seen that much. But that doesn't mean that you're cured, because doctor will also add on to this that when the virus is no longer in the blood, does what we call hibernation. That means it has other parts of the body it hides in. And basically, these parts are like with the joints and the bone marrow. We know that, if I'm right, Dr. CD4 is basically reproduced within the bone marrow. So it basically hides in the places where it would overtake in case of anything. That means it's looking at a place where, in case you decide to not adhere to your medication, it will have the, let me say, the barracks of Uganda, where the army stays or where it's trained. So basically it will come and hide around there where it knows it will easily take over. So if you do not adhere to this medication that we've said, if you're adhering good, the virus is no longer showing in the bloodstream, but it has somewhere it's hiding. That's why we say you do not cure from the virus, because it has not totally left your body. Yes, it has left the bloodstream, but it has hidden somewhere else where it can easily come back and take over.
Medication. If I've realized that I don't have all the symptoms, I've been taking my medicine, and people reach at a time they stop taking medicine because they believe that they have been cured either by taking herbs, or perhaps they've been fasting and prayerful and they think they have been cured. What is your experience or what with such a group of people?
So one I'll say thank you once again. I'm a victim of circumstance. I was once at a time T, prayed for the Bible magic kind of stuff. Pastors, I'm not against the prayers and everything, but I think to some point, I believe miracles do happen. Not attacking any religion, I believe miracles do happen, but to some point, I think we need to be realistic and come up and tell these people, because we know this is not a curable disease, and if God decides to cure you at a time T, which is really, really minimal. So basically, I remember I was around senior 2. I was in my senior 2, and I was taken to a certain church, and I was given water which was prayed for, and they put some oil, and I was told I'm healed. So
you were told, or you believed that you were healed?
Well, basically, I don't think my faith is to that extreme. There are some things where I believe can happen, and there are some things which I really don't. I first look at the science side of it, because this is something they've told you is not curable. So I remember that time I was told I was healed. I stopped medication. So it's sarcastic that the person I was staying with told me I was healed, but then every after 3 months when my appointment reached, I would be given transport and everything. I go to the hospital, pick my medication, come back home and give it to her. But I'm told I'm healed. So I reached a point, I'm a dark-skinned lady, but I became like really, really light-skinned. I became very tiny. I got all those rashes you were talking about. I really looked weird and different. I remember by the time I was changed now to second line, they were like, if you do not change now and adhere, we might lose you in the next 1 week. So these things and herbs are really not a good option. Like, basically, we are told that when you're taking art, these herbs, because we know that the medication also comes from certain different contents and substances, so basically mixing it with herbs may cause it to not work well in the body. Just like they tell us, when you're taking that tablet, do not break it. Why they're saying don't break it is because every small single piece you drop or lose, it's a loss of the substance. So it's basically not good to break it, but also the herbs also may react with it. Just like they say, if you're taking alcohol, please reduce on it, or do not take it within the time range you're going to take your medication, because it will have an effect on the medication. So I feel like pray for the cure to come. But as you're praying, as you're praying for the cure to come, take your medication.
All right.
Yeah.
Dr. Arthur, it's important to also get that experience from the other side, but let's go direct into some of the mechanisms that and also efforts that we have adopted and realized as a country, especially in prevention. I heard there is a vaccine. Do we have any research-based mechanisms that we have established as a country in terms of prevention of HIV and AIDS?
Yeah, thank you. Thank you so much. I think before I indulge into this aspect of prevention, the question you asked, I think, needs a very, very direct answer, because the question was, is there cure? Now, the direct answer that the public needs to know is there is no cure. Just for clarity, my sister has really clarified very well, has put it very well, the myths around the fraternity, the HIV fraternity, the spiritual fraternity, and all those aspects. So the direct answer is there is no cure for HIV, and if you wish, you would put even a full stop so that it gets known. Now, on the aspect of prevention, quite a number of prevention approaches. I know that many people are aware of what we call primary prevention. The original primary prevention, which had what we call abstain, be faithful, and use a condom. Now, that primary prevention approach is still an approach that is noble. It's a very, 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 very good approach. But on top, since times have evolved, you bear me witnesses that quite a number of prevention approaches have come on board, and we have called this what we call the whole package, prevention package, is what we call combination prevention approach. Meaning that we have the ABC on board, but on top of the ABC on board, we have other prevention approaches. One of those approaches that you will allow me mention, moderator and the listeners, is an aspect to do with what we call elimination of mother-to-child transmission. That is, I think you must have heard in the preamble of my sister talking about that she's a mother, and she was free to say that she's HIV positive. But on top of that, she has given birth to a child who is HIV negative. That is what we call elimination of mother-to-child transmission. The virtue of the fact that she has the virus was not automatic to transmit the virus to the baby. And I think that is the happiness of every mother, that is the happiness of everybody, that is the happiness of our country, and that is why we talk about ending AIDS by 2030. Now, on top of having what we call elimination of mother-to-child transmission, we also have we call safe male circumcision. Now, safe male circumcision is also an approach that we use in order to support on the prevention of HIV. We know that around a good percentage of prevention when somebody is circumcised, we very well know that circumcision can support. But on top of that, we also have what we call pre-exposure prophylaxis or post-exposure prophylaxis, what we call PEP and what we call PrEP. All those are approaches that are on board in order to support us in the prevention aspect, prevention of HIV transmission. So in a nutshell, we have those primary prevention approaches, and like I have mentioned, we are looking at combination prevention strategies.
Of recent, there has
having also, I think I shouldn't
vaccine.
end without mentioning the aspect to do with safe blood transfusion, but also supporting, those injectable drug users. We know that those people are out there, and we say that there is need for them to exhibit a safety in order to prevent HIV transmission. Now, you also asked about what we call the vaccine. Now, there are some sensitive questions that basically first need direct answers. Like I've told you, I'm a medical doctor who has been actually in the HIV circles for more than 10 years. So I can say that I have maturity when it comes to HIV programming. So there are some sensitive questions that need direct answers, and the direct answer around the vaccine is there is no vaccine for HIV.
At the moment.
At the moment. Now, what the science will always evolve. Science will always evolve. There are aspects and the approaches that scientists are taking, you know, to look for vaccines. You must have had people looking for vaccines around malaria. You must have had people looking for vaccines around quite a number of infections. And efforts are on also for scientists to try and look for all sorts of, you know, sorts of vaccines. But at the moment, the direct answer is, let us move out of the comfort zones. We do not have any vaccine in relation to HIV.
You're still making, or it is out of stock?
I think what he has said, there is no vaccine for HIV, but just as you said, the myths and misconceptions, most people are taking the PrEP, the injectable PrEP that they were talking about to be released next year. Most of people think that that is a vaccine, but as we said, as doctor said, it is not a vaccine, it is a prevention option.
Right.
And just as he said, it's combining. So you may have the injectable PrEP, but it is also best to use a condom, because none of the science or these options are 100% apart from the condom. Yeah.
Doctor, you also, allow me to get back to you. You also mentioned something to do with safe blood transfusion. How does that work?
Yes, safe blood transfusion, the basic principle and what you call as the best kind of arching principle is to ensure that wherever you get transfused with blood, this blood must be given to you from a certified health facility, because you must have had people who think that, you know, you can go anywhere and you get blood. Some people even have a myth that in case somebody is lacking blood, you can give them blood and they drink your own blood. So the safe blood transfusion, the basic principle is this transfusion needs to be done in a health facility that is government certified. And in the government certified health facilities, the blood there is safe, because there are quite a number of steps that they take in order to ensure that the blood, before it is given to you, is basically safe blood. So that is what we mean by, safe blood transfusion.
Okay. UBC Ground Zero, we are live on 4 radio stations covering entire Uganda, Kampala 98.0 FM. That is on UBC Radio. And also, if you are in Alua, we are 97.4 FM. If you're in Lila, we are 99.4 FM. And we're also live and clear on UBC Butebo. If you're in Bali, we are 96.9 FM. If you're in Soroti, we are 98.4 FM. And if you're in Alua, we can get us on 95.5 FM. We also live and clear on UBC Butebo, and UBC West Nile, and Magic 100 FM. And also streaming live, you just enter live UBC Ground Zero, and you'll be watching us live. Ampaire Amonotega is my name, and I have a privilege and honor to have Dr. Arthur Himsiwe. He's the National Tail for Adults HIV Care and Treatment, coming from the Ministry of Health. And we also have Lilian Humuro, is the Advocacy and Communications Officer, coming from Uganda Young Positives. We're talking about ending AIDS by 2030, and we are keeping communities at the center. You'll be reaching us on 776-511-426 to be part of the conversation, but I also can send you messages on 0701 24 26 47. Kehumoro, ending AIDS by 2030. Is it possible?
Thank you very much for the question. I think, just as we explained in the beginning, there's a difference between HIV and AIDS, and our theme or our role was ending AIDS ending AIDS by 2030 as a public health threat. We are not saying end HIV, because as Dr. said, there is no cure for HIV. But ending AIDS by 2030, what do we mean, or what are we looking at? That in the population that we have, our Ugandan community, at least 95% of the community should be tested and they know their HIV status. And among that, people who know their HIV status or have found out they are positive, we should have at least 95% of them on medication and taking medication or started on medication, among these people who have started medication, we want to see at least 95% of them adhering to medication. So when we have people adhering to their medication, they have been tested, they have found they are positive, they have accepted their status, and they are taking their medication very well and adhering to it, they will not have the risk of transferring from HIV to AIDS, because we said AIDS is a collection of diseases. So once someone is adhering to their medication well, then they will not go to the stage of AIDS. And we are saying, yes, it is possible to end to end AIDS by 2030 as a public health threat, with the condition that people are taking their medication well. What do we need? We need to end stigma and discrimination, which is one of the biggest monsters that people living with HIV face. 2, we need to support people living with HIV to be able to disclose, because as we see, Doctor, you clarify on these statistics, we say currently they show us that we have over 1.4 million people living with HIV, but only 1.38 of them are actually on medication, and they say 80,000 of these people are not adhering to their medication. So the risk is not the 1.3 people who are adhering to their medication, but the 80,000 people who are not adhering to their medication. Because one, since they are not adhering, there's still a lot of stigma. Their disclosure will be very hard. And remember, we are seeing the current rate of population or people living with HIV are young people or the youth. And these people are sexually active. They have multiple partners and they're not disclosing. So one, that means they're going to transmit to more than one person, but also the people they've transmitted to, because they do not know, they were not disclosed to, they will still transmit to other people. That means we'll have a whole circuit of people transmitting to each other without knowing. So the only way we can end AIDS by 2030 is reducing stigma to ensure adherence, and also psychosocial support to support these 80,000 who are not adhering, take their medication well, and then reduce the rate of new infections, but also prevent these 80,000 people who are not adhering to their medication to reach the stage of AIDS, because it is only when you reach the stage of AIDS, or only when we prevent people from reaching the stage of AIDS, that will end AIDS by 2030 as a public health threat. Thank you.
Interesting. Thank you for that. Dr. Arthur, we also said in our theme, keeping communities at the center. How best can we keep communities at the center of this fight?
Yeah, thank you so much. Yeah, they are basically nearly the same, like you have said, keeping communities in the center. But just to be more specific, maybe in the wording, is let the communities lead. Not only keeping them in the center, but taking leadership.
As it was international theme.
Yes, as the national and the international theme, like you have put it very, very clearly. Now, like my sister has explained, we have quite a number of progress in terms of achievements, and like we always say, these are multi-sectoral achievements. We have not achieved them as the Ministry of Health alone, AIDS control program, but these are achievements that we have worked together in different sectors, looking at the education sector, looking at the Uganda AIDS Commission, looking at the Office of the President, all quite a number of sectors that we have worked together in order to have quite a tremendous achievements in the fight against HIV. Now, the question you have asked is, how can the communities take leadership? I can comfortably confirm that actually we have been working with communities hand in hand, and that is why you are able to invite me from the center, the Ministry of Health, but also you invite my sister, who clearly told you that she is in the advocacy area, and she is part of the people living with HIV community. So we work actively, but also constructively with them. Now, the aspect of let communities lead, this is the center of our focus, because where we have reached, we believe that everybody actually believes that there is nothing for us without us. There is nothing for us, the people who are living with HIV, without us. So the people who are living with HIV are now a center of our focus. As the Minister of Health, a center of focus in the global face. And like she clearly told you, the civil societies or the PHIV networks, population living with HIV networks, are basically at the community levels. They are within the community. They know what is taking place in the community. The challenges that they are facing, they can easily contextualize them probably better than us who are at the center. So we believe that constructively and meaningfully working with them closely is an avenue that provides us with an opportunity to clear up the challenges and get for us opportunities and solutions that we can use in order to end the disease by, the epidemic by 2030. So we believe that the communities, if we put them at the center, then it will be a very, very, very big opportunity for us to work with them, identify the challenges that are affecting them, and we design solutions that we can use, but we design those solutions with the community of people living with HIV.
Interesting. Our dear listener, you're still on UBC Ground Zero. We are live on 4 radio stations covering entire Uganda, but also we are streaming live on YouTube. In case you want to watch us live, you just put UBC Ground Zero and you'll be part of this conversation. I'm taking a very short break. We're talking about AIDS, ending AIDS by 2030, keeping communities at the center, but also letting the communities lead. 776-511-426 is the number that you're going to call immediately after the break. I'll be picking your calls, but also reading your messages. Keep them coming through. I have seen some coming through already, but keep them coming through on 0701 24 26 47. I'm coming back in just a minute. I pray you don't go anywhere.
This is Ground Zero Season 2. Stay tuned. We shall be right back.
we had a very informative and educative and inspiring speeches and comments from leaders and many other stakeholders. A day when the world stands in for solidarity or in solidarity with those who are living with HIV and AIDS. We continue with this discussion on UBC Ground Zero today, and we have a privilege and honor to have Dr. Arthur Himsue, who is the national team, the national team for the adult HIV care and treatment, coming from the Ministry of Health and the Department of AIDS Control Program. And also have Lydian Kihumuro, is the Advocacy and Communications Officer, coming from Uganda Young Positives. 776-511-426 is the number you can call now and share your concern, ask any questions for my guest in the studios of UBC to answer you. And how best do you think we can end HIV by 2030 or AIDS by 2030? Is it possible? What is your concern? What is your problem? What is your challenge? What can we do? And what can you tell those who are still living with HIV AIDS? Also, keep your messages coming through 0701 24 26 47. Ben, you are listening in from Kajansi. You are saying, when does someone have AIDS? And also, Carolina, you say, can I get HIV through kissing? And also, someone, you say, how to manage HIV? This is Odonga. You say, how to manage HIV AIDS with the positive attitude. Kanyole, you say, what is the assurance that condoms can prevent the HIV? Since the ministry and other stakeholders have warned us about some condom types which can be at risk. Your message is, I believe that Kanyode, you send your message again, but I think you are saying that how can I be assured that condoms prevent the virus 100%? Keep your messages coming through, or you can call on 776-511-426. I will be able to pick that call and be able to answer that concern or attend to your question. If I can go back to the studios for those questions coming from the people of Uganda, I will get this caller. UBC, you're live on Ground Zero.
Yes, hello.
Hello, you're live and clear.
Yes, thank you for the show.
You're welcome, and thank you for being part of us.
Yes, this is Veronica from Kono.
Your name again?
Veronica from Kono.
Yes, Veronica.
Yes, please.
Your concern, please.
I want to talk about, I have my brother. He married a wife, but the wife is also HIV positive. But my brother is not affected. I don't know what brought that. And the children they produced, they are not also affected, but it's only the wife. But they gave my brother a medicine to be taken. I don't know what is that for.
Okay.
Yet is not affected.
All right. Serious concerns coming from the people of Uganda. Monica, thank you. Listening in from Kono, and I believe my guests in the studios are going to answer that very well. You're live on UBC.
Hello.
Ground Zero.
Thanks for the program.
Most welcome, sir.
And I appreciate our doctors around, and I appreciate the lady so much for the confidence she has.
All right.
And that is the way to go.
Indeed.
If you are, you are. You have to take, if you take constant and move the next step peacefully. Now, my concern is...
Your name again? Your name and where are you calling us from?
I'm called Emmanuel Amien Kajan.
All right.
I wanted to know, they talked about PrEP as one of the ways to prevent. But what are those steps for someone to take PrEP? Then the other one, what could be those, this one goes to Dr. Asa, what could be those pointing, you talked about not looking at judging someone, not diagnosing by the eyes, but could be there like some specific other signs of infected person?
All right.
Those are the two questions I had. Thanks for the program.
You're welcome, sir.
All right.
Thank you for being part of us and raising such interesting comments and concerns. 776511426 is the number you can call and reach to us by sharing, or you can share your messages on 0701 24 26 47. If I can read another message, I'm Kadomo Samex from Soronko. Can PrEP reduce the chances of acquiring HIV/AIDS when accidentally someone is raped with an infected person? Thanks, and we also thank you, Kadomo, listening in from Soronko. Allow me get back to the studios of UBC for my guests to answer those concerns, and then we'll keep on reading the messages, keep them coming through, and I'll be picking your calls. Let me start with you, Doctor.
Okay, yeah, thank you so much, and thank you so much, listeners, for very, very insightful questions. I tend to have missed the sister's name who asked about, the brother.
Veronica.
Yes, Veronica. Veronica, thanks so much for asking that question. What you're asking is what we call discordancy. In the medical language, we call it discordancy. Now, discordancy is an avenue where you talk of discordant couples, where you find one of the persons in the relationship has the disease or has HIV as a virus, but the other one does not have. Now, I'm going to try my level best to use the basic and the simplest language to explain this, so that my sister Veronica and other people who may have had challenges with it get to understand it from the basic principles. Now, when the virus called HIV enters somebody's body, in normal circumstances, for it to start growing and start increasing in somebody's body, it must enter into what we call CD4 cells. Now, CD4 cells are the cells of the body, within the body, which are supposed to be fighting against infections. Now, for it to start growing, this virus, for it to start growing, when it enters into the CD4 cells, it is supposed to find there what I can call a seat where to sit. If the seat where to sit is not there, then it will remain hanging. It will not sit anywhere to settle and start producing. In the people who get HIV, they always have those seats, meaning that if the HIV virus enters somebody's body, it will find the seats where to sit. After sitting, then it settles. After settling, it starts producing. Now, the people whom we call discordant, who don't have HIV, one of the explanations, scientific explanations that we have is that within their body, they don't have those seats where the virus sits. So meaning that when the virus enters, it fails to get where to sit, and it eventually dies, or it is attacked by the body defensive mechanism, and it dies, and the person does not get the virus. That is one of the theories that we use. But remember that this person who doesn't have the virus today, who doesn't have the seats where the virus is supposed to sit. You may not know. In the future, the body may manufacture those seats, because in normal circumstances, everybody is supposed to have those seats. Now, a few proportion, maybe less than even 1%, a few of the population does not have those seats. But at some particular moment in time, who knows, the body can easily manufacture those seats, and then a person eventually gets HIV. So that is why we always say that for people to stay in a discordant relationship, they need to approach the healthcare facilities so that they are able to be supported in how they can stay safely in the discordant relationship. And one of the mechanisms of staying safely is the person who is HIV infected needs to remain on drugs, adhere on drugs, without missing any of her doses. But on top of that, they can even give them condoms and say, please, you need to use condoms. Now, other instances, this is why the sister was saying that, my brother was given drugs but is not infected. Most probably you might find that those drugs were given to the brother in order to enhance on the prevention capacity. So like I said, even when the person doesn't have those seats, there is a possibility of developing those seats within their bodies.
Could this be PEPs?
The what?
There are PEPs as well? PEP.
PEP means post-exposure prophylaxis. They are not PEP. We call them PrEP.
But
yes, but I didn't want us to go that direction. For us, and it is tested, humanity, when there is something to hinge on, humanity wants to dwell on it so much, and at the end of it all, they end up draining. So the PrEP that you're mentioning is supposed to be given only to the high-risk groups.
All right.
PrEP, not PEP. So most probably the drugs that this gentleman has could be, PrEP in order to prevent him from acquiring the virus.
Maybe another concern now?
Yes, the other issue, when does someone have AIDS? I think maybe my sister can explain that. She had explained
She had explained that very well.
Yes,
but
yes.
Also someone said, can I get HIV through kissing?
Yes. Would you want to? Yes, she wants to explain it.
Thank you. If possible, there's what we call the Aura, the self-testing kits. There's Aura, Quick, and Sure. So I'm trying to come to the question of can somebody get HIV through kissing before I answer the question of.
Maybe you can as well go with this one as well. UBC.
Yes.
You're live and clear.
I am Amodoi from Ngora.
Your name again?
Amodoi from Ngora.
Ngora
in Teso region.
Oh yes. Thank you for being part of us.
Yeah, I am following the program. But there is something which I wanted to suggest.
Please.
No?
You're live, you're clear.
Yeah. This is the case of to try to reduce stigmatization among people who are HIV positive.
To reduce what? Hello?
Hello?
You're getting me?
Yes.
Okay, your concern, please.
Yeah. I'm saying I want to make a suggestion on stigmatization for people who are HIV positive. My suggestion is that there are people they want to produce. Reproduction is an aspect of characteristic of a living thing. And when somebody grows up, he or she, even if she is positive, would want to have a baby or a child. So I am having the view that if the organization could consider seeing how they put these people together so that they choose partners and they end up getting children, I think we'll be able to end up that stigmatization within 2030. For those who may not wish to have partners, I suggest that men can deposit their sperms in the maternal units of Mulago, and then ladies can try to pick them from there and follow the owner of the sperms to see the status of that person, whether he or she, whether she can take it, and then they get that kind of sperms, so that once somebody gets a child, she will feel she's not an outcast again, because when you don't produce a child, you will think it will stigmatize them the more again.
All right. All right. Thank you so much, sir, for that serious concern.
Okay, so that's my suggestion. I wanted the committee to dare to consider.
All right. Thank you, sir.
But I thank them for informing the community about what is going on.
Okay. Thank you, sir.
We thank them very well. I am Amudei from Ngora.
Okay. And I from Angola.
Yeah, thank you.
UBC Ground Zero, you're live and clear on 4 radio stations and also streaming live. And keep your messages coming through. We still have time, and I believe that we are going to attend to all of them. Let me get the last one on this, and if time allows, we shall get more calls later. UBC?
Yes, good morning.
A very good morning to you. Your name and where you're calling us from, sir?
I'm called Lawrence Kali from Make Chikoni.
All right.
I'm a victim of the virus.
Oh.
I'm 57.
57 years?
Yes.
Okay.
And I'm really happy to hear the gentleman explaining and that young lady. And then yesterday I had the president, and I got a chance to read the New Vision, which had detailed information about AIDS. I didn't know much all about that, and I felt I would join in the struggle of fighting, of eliminating this, to join. They say together you stand, and I will think of how to find such people to enlighten me and to help me to work together,
okay,
to fight this.
Are you taking medicine?
Come again?
Yeah, are you on medication?
I'm on medication at IDI.
All right.
Yes, but I'm still lacking more interaction and relationship with people. With people I'm concerned to work with,
Okay.
Am I clear somehow?
Yes, you are. And I believe that someone is going to get in touch with you. Thank you for being part of us and for the encouraging statements.
Thank you.
Allow me now, for now, to pause the callers, and if time allows, we are going to get more callers later on. But allow me go to the studios to answer some of these concerns. Lydian, you can start from there. Thank you for giving me part of your time.
Thank you. Before I start, Doctor wanted to add on something. So
maybe you can come later. Let's
okay.
First end at that point before we come to Doctor.
Okay. So thank you. I was still on the point of kissing. So it is scientifically proven that saliva does not contain the virus, and it's said that you can only get the virus from saliva if you take up to 20 liters of a jerrycan in one kiss. But this does not mean that you cannot get HIV through kissing. So how are you at risk of getting HIV through kissing? It is only a risk if the two people, the partner, the two people involved in the process of kissing have wounds in their mouth. If you have wounds in your mouth, then you are at risk of getting HIV through kissing. And then I know a person will say, but then they give us the self-testing kits, the Aura Quicks, which they use in the mouth. Yes, they do that, but the portion or the liquid that they take from the mouth is usually not saliva, but it's the antibodies that are formed within our mouth. That's how they're able to react and get the status of whether you're positive or negative. Somebody also asks, when does someone have AIDS? And just as I started in the beginning, I said there's a difference between HIV and AIDS, and we say that AIDS is the situation where the virus, the HIV virus, has manipulated your body and taken control of your your immune system, it has taken over your immune system to a rate that it can reproduce and multiply in the body, and then your body is very weak and can get very many diseases. So we said AIDS is a collection of diseases and infections. So you can only get this when you're not adhering to your medication, you have a high viral load and a CD4 below 200, if I'm right, doctor. A CD4 below 200, then you are at risk of getting AIDS. Then how to manage HIV positively? I think
with a positive attitude.
Yes, how to manage HIV with a positive attitude. Just as I said, I'm soon making 27 and I've lived with HIV for this amount of years. So it's basically having, one is accepting your status. If you do not accept your status, you'll be very weak. It's a great pity that I lost my mom in May this year. And one of the biggest things that killed her was depression. And depression, basically, she reached a point where she gave up on herself. She was one of the people who adhered very well to her medication, but she gave up on life, she gave up on herself, and she succumbed to AIDS, if I would say that. Yeah, she succumbed to the disease because of the psychosocial effects that come with not accepting the status. So she reached a point when she was too much tired of everything. So if you do not accept your status, then basically you will fail to adhere to medication. So one of the things I say is, once you're tested positive, know that you're not alone in the struggle. Reach out to people who are very close to you and who can support you. And then 2, have a dream, have a goal. One of the things that kept me going is the goal to make a difference and to show that I can be somebody even with the virus, to defy the virus. So basically have a goal and then accept your status, listen to the doctors, adhere to your medication, and believe me, you will, even if you have a dream of being the president, you never know, you could be our next president. Then steps for PrEP. Just as doctor said, PrEP is basically given to people. There's a difference between PEP and PrEP. Somebody asked about, can PEP prevent HIV? And
from Selonko.
Yes, the gentleman from Soronko. PEP is medication given after exposure, or people who have been exposed in high risk cases. For example, what he talked about of rape. Any person who has been raped has freedom to access PEP within 72 hours, basically. So if a person goes there after 72 hours, then PrEP is no longer usable, it's no longer needed because it's past the time it can really work in the body. And then steps for accessing PrEP, just as doctor said, one of the people they give PrEP are discordant couples. But these discordant couples are when the person who you're dating or the person you're in a sexual relationship with has a high viral load, then there they can give you PrEP. Then also people who have multiple sexual partners. If you have more than one sexual partner and like you're in a high risky sexual behavior, then you're also a person who can access PrEP. Like let's say you have a WMVD, somebody for the nails, somebody for the clothes, somebody paying rent, but you're really in a sexual relationship with all of them, then you're also at advantage of getting PrEP. People who inject with drugs, those people are also a high risk population because one, the drugs they take tend to take them off the mind is really not functioning in the reality kind of way, so they are at risk of engaging in any sexual activity with a person who the status they do not know. But also too, they share injections, so those people can also access PrEP. Then we also what we call the commercial sex workers, they are also able to access PrEP. Then lastly, I wanted to hint a little bit on the question doctor wants to talk about on joining couples who are living with HIV or depositing sperms to a certain facility so that these people can access can give birth. As I said in the beginning, I'm a mother, my baby boy is starting school next year, he's healthy, he's HIV negative, and the father is negative too. So basically, if the community decided to do this, then we'd be raising the stigma and discrimination issue, which we're actually fighting. Because anytime you decide to connect or have that rule of let's put sperms, let's do this, then we are really not educating the community, and we are also increasing stigma.
Interesting. Dr. Arthur, you had a concern? Or
Yeah, thank you so much. Partly, I think she has addressed it. The aspects, the gentleman was talking about, looking at sperms, looking at connecting these people, the PHIV networks. What I wanted to clearly bring out is we are at the verge of beating stigma. And honestly speaking, if somebody remembers or has read history of the 1980s and the 1990s, you can bear me witnesses that it would not be so easy. My sister has told you she's 27 years. It wouldn't be so easy for a 27-year-old person to come out on a national TV station or national radio station and clearly say, I am here, living, with HIV and that kind of thing. So we are beating that stigma, and we need to embrace that kind of aspect. Now, the gentleman, I fully appreciate his ideas, but currently, there is no big outcry that, the people living with HIV are not getting husbands. People living with HIV are having, challenges to do with giving birth. She has clearly told you, and from the horse's mouth, that she has a baby, and this baby is HIV negative. Now, moderator, maybe just to give you a little bit of fact statistics, specifically around what we call elimination of mother-to-child transmission. Now, just a few years back, around 2010, we had quite a number of children that were getting infected from their mothers. But currently around 2022, we are talking about 5,600 children, getting infected. So you can see that we have moved a very, very great deal, and it is no longer a very big threat that somebody is HIV positive and they are not going to give birth to an HIV negative child. Right. No, it is no longer really a challenge.
Doctor, there is also another concern.
Yes, you can be HIV positive and you give birth to an HIV negative person. Now, the other concern that I wanted to hint on is about PrEP. Now, PrEP is an aspect, that is given to special interest groups. They are so the mindset that I want to build in the population is a mindset of not thinking that they are going to mess up themselves here and there, like the president said to those ones who were present and those ones who may have had, that you're going to mess, and then afterwards, messing intentionally. These are special interest groups that are supported to prevent them from getting infected. Right. So if somebody is going to intentionally mess up, thinking that there is, PrEP and that kind of thing, I don't think it is the right mindset for us.
Doctor, someone also says, how can I be assured that condoms work 100%?
Yes, thank you so much. These are tested ventures. For condoms to be brought on board, and they say that it is going to protect you to some percentage, but only if you use it very well. So that means that for you to know that the condom is going to protect you, first and foremost, you need to use it very well. You need to ensure that you are buying this condom from a certified health facility or a certified drug shop or pharmacy that is certified by, the Ministry of Health, not illegal shops. And you also must ensure that you are using it very well and consistently. So that's when you can basically know that the condom is going to support you. Some people don't use it consistently. Some people don't put it on very well. Some people don't buy these condoms from certified or government health facilities to get them from the certified government health facilities. And even some people actually don't take time to look at the expiry dates of these condoms that they have gotten from wherever they have gotten them from.
Interesting. Yeah. Someone says, I am Jacqueline, I think it's Jacqueline, and she's saying, I'm expecting, pregnant, I'm expecting, and by next year, Feb, I'll be having my firstborn. But I am also HIV positive. Can breastfeeding lead to HIV transmission?
Yes, now that is a very, very good question.
That can she breastfeed when she's positive?
Okay, thank you. Just as I said, I'm a mother. I breastfed my kid until he was 1 year and 6 months. Actually, they told me to stop at 12 months, but later on they told me to continue. So currently they say we can breastfeed up to at least 2 years. So basically, as long as, just as we said, it's all about acceptance and adherence. As long as you're adhering to your medication and you're listening and doing what the doctors tell you, you can breastfeed your kid and you can have an HIV negative kid. When I say what doctors are telling you, at the moment we give birth, basically Ministry of Health puts these adverts everywhere. Breastfeed your kid. I'm forgetting that what they say. Breastfeed your kid without mixing any other things. Exclusive breastfeeding for 6 months. Because why do they say this? You know, most of us give birth from our parents' areas, and our judges and moms have those herbal things they give our kids. Simanyi, it's going to remove enjoka, mulubuto, those kind of things. But basically, they tell us this because the baby's alimentary canal is still very weak, and also the baby's immune system is still very weak. So basically, their first immunity or their first body, the things that can support their body comes from the mother's breast milk. So they tell you either breastfeed your child exclusively, or if you decide to not breastfeed them, give them milk, but do not mix the two, because anytime you mix the two, you're exposing your child, you're playing with their immune system, and that means you may expose them to the virus. Two, if you're adhering to your medication, then just as we said, the virus is undetectable in the bloodstream. That means the risk of giving this baby the virus is low. So as long as you listen to what the doctors tell you and you adhere to your medication, then yes, you can breastfeed your kid. And as long as you listen to what they are telling you, then you will have chances of giving birth or having an HIV-free child.
All right. Good morning, UBC. This is Sulaiman from Tororo. Me, I'm having all signs of HIV, but whenever I test, they find me negative. What could be the problem? I love your program.
Before doctor comes in, I would want to ask, the signs he's saying, just as we said, there are no signs of HIV. There are signs, we have signs and symptoms for AIDS, but we do not have signs and symptoms for HIV. So basically, this person may have some infection or disease that they have not yet found out, but because his mindset is still in the 80s and 90s, or on the symptoms of AIDS, this person may actually think they have AIDS, yet it might be another disease. So I would advise the listener to go to a health center or a hospital and talk to do a consultation and have a thorough body test or test on whatever disease they may be having, because as we said, HIV does not have any signs and symptoms.
All right. Also, someone, doctor, you had a comment. You had something to add on that?
Yes. I think I can add on that, but through moderator also allow me say that the 5,600 to around 5,900 new infections from mother to child transmission, around 44% occur during pregnancy, and 56% of those infections occur during breastfeeding. See, the good thing, I have all words from
during pregnancy mouth. Or during delivery?
During pregnancy, 44%.
So a mother can pass on HIV to the unborn baby?
Yes. That is if if this mother does not follow all the procedures as told by the healthcare workers. So 44% occur during pregnancy, and 56% occur during breastfeeding. So it means that we have a great deal of infections in our children from mother to child occurring around breastfeeding period. What does this mean? It means that this mother needs to strictly adhere to what the healthcare workers are telling her. And one of those things they will tell her is, you must adhere to your drugs. When you adhere to your drugs, you're sure that the level of the virus in your blood is low, so that transmission to your baby is basically reduced. So that is something that needs to be put into perspective.
Adding on a little bit to what doctor says, I was working in the hospital the gentleman talked of, Infectious Diseases Institute, under the EMTCT clinic. And one of the main concerns or issues we face is that mothers, or pregnant mothers, or mothers who are breastfeeding, basically do not want to give their children this medication. As the mother is taking medication, there's also a prevention medication given to the kid. From 0 to 6 months, it's from 0 to 6 months or 4 months, it's a syrup, the nevirapine syrup. Then after, they give them a pill. This is in case there's any risk given to the child, there's this prevention option. But one of the issues we have is mothers do not want to give them the medication. I remember there's a mother I met when we were there, and she said, I cannot give my kid this medication as long as I'm taking. And sadly, by the time they did the last test, it showed that the kid had turned out positive. So basically, it's listening. Sometimes us as patients, I'll use in Uganda, twefulant tumanyi nnyo, but basically, the doctors are trying to support us have healthy babies. And every time you fail to listen to what they're saying because you feel you know a lot, it may give your child a risk. So if, as you're taking your medication, there's a medication given to this kid until they do the last test and they prove that the kid is negative. So just as he said, as you adhere to yours, may you please also enable that the child, you may support the child adhere to theirs.
Thank you. Bogere Francis is appreciating the program on YouTube and saying very educative, thanks to UBC. And I was asking about how about during pregnancy, and I thought that was answered during our discussion. We are continuing with this UBC Ground Zero edition. We're talking about how best we can end AIDS by 2030 and letting communities, keeping the communities at the center, or letting the communities lead in this very fight. Someone says, I am fearing to go for tests. I don't know what you can answer this very person. He would love to go and find out his status, but he's fearing to go and test.
Yes, and just to allay his anxiety, fear is human. Fear is human. Now, what does not become very human is the sustainable fear, even after being told that there is no need to fear about. Allow me, moderator, to repeat this. Fear is human. Anybody can fear. But now the challenge is, if somebody is told that there is nothing to fear about, and he or she continues fearing. So I believe that since he or she has asked this question, we are going to explain to him. Was it a him or her?
I think I didn't put the name.
Yeah, we're going to explain to him or her, God willing, if he or she is listening, so that the fear is allayed. Now, first and foremost, we have clearly said that HIV AIDS is no longer something to fear about. It is a disease like anybody would have, and there is no reason for us to get stigmatized. Now, the second bit, all health facilities, the public health facilities that are certified to test from near the health center 3 level of the health of government up to the national level, there is always a place where they can be tested. Now, the other best option that we have brought on board is what my sister talked about, HIV self-testing. Now, HIV self-testing is equivalent to self-service. So you can imagine now, if somebody is going to fear all those options, then we may begin to think that we assess him or her if there is an abnormality with him or her. Because we have HIV self-testing, we have those HIV self-testing kits that you go to a hospital, you go to a health facility, and those kits are given to you. You even don't need, there are those that you don't need blood. You don't need to use blood. You just need to pass it through the mouth. So you go to a health facility, they explain to you these HIV self-testing kits that they give you. They give you ways and means of how best you can use them, give you procedures, and you can go and comfortably test yourself within your bedroom, within your sitting room. So there is nothing really to fear about testing currently, especially in the 21st century, this era.
Also, Bogele Francis says the doctor didn't explain how unborn baby can acquire HIV in the mother's womb. I would like the doctor to clarify on that.
Yeah, thank you so much. My sister, would you want to
He's passing that? It to you. You're the one who raised that concern.
Yes, moderator, if you allow me, so that the horse's mouth, because she has a baby who is HIV negative, and I believe
so Lillian
that
will pass it to you. Can an unborn baby really be able to get HIV when it's still in the womb?
Yes, thank you very much for the question and for Dr. passing it on to me. Horse's mouth. Okay. So basically, we say there are 3 forms in which HIV can be transmitted to a baby. When the baby is being formed in the womb, at birth, and during breastfeeding. And why do they say HIV can transmitted, or how can it be transmitted to a baby when the baby is still in the womb? We know that when the baby is still in the womb, they are basically surviving on their mother. Like, basically, when the baby is still in the womb, it's the mother who is supporting the baby. So we have cases, one of the most common cases is GBV, where if this mother is going through gender-based violence issues, the baby, it's called, that sac is called what? Where the baby sits, the embryonic sac, and then there's the it's called an umbilical cord or what?
Yes.
So there's the baby and mother share a lot. So basically the thing where the baby sits is like a protection gear. And we say that the baby's body is still very, because this fetus is still developing into a baby, and then it finally develops into a baby. If there is any case where this protection gear where the baby is harmed or torn, then there's direct contact of blood or fluids from the mother to the kid. And then number 2, basically some of us, there are those families where when a mother is pregnant, they give them herbal medicines. I hear they do A, B, C, D. Basically that also has an effect on that cord, and that means there's direct contact. And once the baby and mother share any contact of blood and the mother is not adhering, then the baby is at risk of getting the virus.
Interesting. The time we have is now to give the way forward and add messages, advices, and on a number of issues. We're going to start, but before we go into that, actually that would also go into that line. Someone says, the last time I went for testing is called Benin. It says that last time I went for testing, I left my results there because the counseling, the person that I met on counseling, the lady in the course of counseling me, I actually developed more fear, and I excused myself as if I was going to use the washrooms, and that's how I left the results.
Okay, I would love to.
That is counseling itself intimidating?
So I would love to respond to that. I believe the person who asked the question must be a young person or a youth, and basically just as the first person who talked of the fear and all that, as youth, as I said, we are too sexually active, like we have too many partners, and most of the times we have what the youth call kashua. and also sweet tebamnunira mukavera. There are those two things that youth talk about a lot. So those two things are things that cause a lot of risk and then high fear. Because you know sweet obadde tomnunira mukavera ate obadde ofuna bushua, that means you've not been testing most of them, because kashua you're not going to tell the person let's go and test there and then. So that 5-minute thing that people do, like, and because you know you've been with many people and you're not sure of any of them, that's why we have the fear that comes with going for testing. Then number 2, yes, counselors at times, the counseling at times might sound scary and all that, depending on who is counseling, but basically it's because of the sympathy that the way counselors are taught or brought up. They're not meant to be rude. They're taught to be kind, to be sympathetic, to talk in that humane kind of way, that humble kind of way. So with that talking, most times I remember when I was doing the part of counseling and testing, most people would be like, Musao, just tell me my results, are they positive? Because of the tone itself, the way somebody talks, it feels pitiful. It makes somebody get scared that I may be positive. But secondly, because all counselors are trained that before you give results, give the person both sides, so that by the time you give the results, the person is already prepared.
All right.
Yeah.
Also, Kadomo was listening in from, I think, first sent in his message of listening from Solonko. Says, do utilize of condoms have any effects? I think is in case I think he meant overusing condoms. Does it have any effects? And also says, someone with the blood group O, can he or she be able to resist the virus? That is Kadomo Samex listening from Solonko.
Okay, so thank you. The first question was condoms. Actually, the doctor said proper, accurate, consistent, and proper use of condoms is very important, and it doesn't matter how many times you use condoms. Actually, I would prefer, unless you're ready to, unless you're at the preparation that you know this person's status and you're really sure, then, and you're actually in a committed relationship, then maybe, just maybe, the condoms can go. But there's no negative effect of using condoms for very many times. There is a positive effect because you are reducing the risks of HIV and unwanted pregnancy.
All right. We would love to continue with this kind of discussion, but time is against us. I would love to get your final comments and parting shots and concluding remarks. Let me start with you, Lillian, to sum it all, especially from the time we started up to this time that we're ending, comparing the last yesterday's event, the World AIDS Day, and what is your word to someone who is listening to us from the other side of radio?
So I'll start with my fellow young people and people living with HIV. Adherence is very important. We know the current research shows U equals U undetectable equals untransmittable. So it begins with us. I believe HIV should stop with us who are infected. Let's not pass it on. Let's not have to be the cause of somebody else's suffering. And then to the people who are at risk of getting HIV, if it's not on, it's not safe, please go test. There are free testing services in all government facilities. Go test, and then please seek to understand and know information, because if you dare cross the line to becoming positive, there's no going back. Yes, there is hope for future, but it changes a lot in your life. So let's keep the information going. Let's support each other, reduce stigma, and let's keep working towards an HIV and AIDS-free generation. Thank you.
Doctor?
Yeah, thank you. Thank you so much, moderator and listeners. You will allow me have a call to action to the young people, to men, to parents, and probably lastly our leaders. Now, to the young people, there is a need for us to avoid peer pressure, because you agree with me that consequences of sex are not shared by your friends. Just because your friends are talking about sex is not is supposed to drive you into the same direction. There is a need for you to abstain from sex until you are ready for the consequences and take responsibility that comes with it. Concentrate on your studies, concentrate on your books. The good things are in the future. Now, to the men, to the fellow men, you realize that you are the champions, you are the heads of the family. Take leadership to end cross-generational sex in our communities. Very, very important. There is need for us men to embrace safe male circumcision, because we know that it can decrease on your risk of contracting HIV, though not 100%, but at least there is need for you to have a safe male circumcision. The other advice to men that I would wish to give, there is need to remember that as a man, you can only achieve your dreams if you are healthy. So there is a need for you to stay safe. But most importantly, as men, there is a need for us to support our partners, to breastfeed fairly well, and have adequate healthy meals, and also support our partners to take medication. Now, to the parents, and the beauty of it is that this is the period when the children are at home. So there is a need for parents to spend quality time with our children and set ourselves as living examples. Furthermore, there is need for us to create an enabling environment at home for our children to freely discuss some of these body changes without having any shame. But also there is need to understand and discuss the unique needs of the young people within your homes, the young people within your environment, especially the adolescent, such as, body changes, attraction to the opposite sex. These are things, these are lessons that parents do not need to shy away, but rather to discuss openly with their children. Then the last aspect, moderator, is an aspect to the leadership. Leadership at whatever level. If it is religious leadership, spiritual leaders, government leaders, all leaders at any level. What message can I give them?
Right.
There is a need to ensure inclusion of people living with HIV in the economic empowerment and social protection programs, but also local government leaders to ensure that there is a 0.1, it's I think a 0.1% of the local government budget that is supposed to be allocated to HIV and AIDS activities as directed by the Ministry of Finance and Economic Development. Lastly, specific also to the leaders is the need to ensure that HIV and AIDS coordination structures at the district level, at the regional level, at the parish level regularly meet and discuss HIV and AIDS performance and ensure accountability for HIV and AIDS service providers. Thank you so much for listening. Over to you, moderator.
This brings us to the end of our discussion. We've been talking about ending HIV AIDS by 2030 and letting communities lead. It was a privilege and honor having you, Lydian Kihumuro, joining us today on UBC Ground Zero.
The pleasure was mine as well.
Interesting. And it was also great having you, Dr. Arthur Himsuwe.
Thank you so much. It's a pleasure. Thank you.
All right. Lydian is coming from is Advocacy and Communications Officer, coming from Uganda Young Positives, and also Dr. Arthur Himsuwe is a National Team Leader for Adult HIV Care and Treatment, coming from the Ministry of Health AIDS Control Program. This brings us to the end of our discussion. Go test for HIV for those that have don't know your status. And for you who know your status, please endeavor to adhere to your medication, take your medicine and in time. And for those who are married or in relationship, be faithful to your partner. Together we can end HIV/AIDS by 2030, especially when you and I, and especially the community, is led in this. Many thanks to the team I worked with, Hilary Katurebe, Alex Alnaitwe, and Bob Brian Mugisha, those who have been part of us from the technical team, camera, and the rest, and also our producers, Doreen Daisy, I'm Cimenta Allen, and many thanks to also our program officer, Frank Yiga Masajage. Mpaire Amonoptega is my name, and next time, be part of us for Ground Zero. It's always on YouTube. You can always search for it and you'll be to get this content. And also we have a repeat of this very program on Sunday from 3 p.m. to 5 p.m. This brings us to the end of our discussion. For God and my country, I'm Pedro Amon Butega, Alamed sign out.
That was